Well, thank you very much for the kind introduction. It's an honor for me to join you here today. Interesting to be having this conference during a government shutdown, but you never know where the world's going to take us when you schedule these things out. I want to first start off by thanking Mary Beth Donahue and the entire team at the Better Medicare Alliance for bringing us together. You represent a coalition of health plans, providers, advocates, and community partners that share one mission, and that's protecting and strengthening Medicare Advantage for the millions of Americans who depend on it. And your work matters deeply to me because Medicare Advantage is not just a topic of debate in Washington to me. It's a lifeline for millions of seniors across our country. And it's a lifeline for thousands of families in my district, in Western New York, in the southern tier of New York. And everywhere I go back home, I hear from seniors who tell me that Medicare Advantage gives them peace of mind. They know that what their costs will be each and every month. They have access to coordinated care and preventative services. And they know that their plan will help them stay healthy, stay active, and most importantly, stay independent. And as we begin the Medicare open enrollment period this week, those conversations take on an even greater meaning. Seniors are making important decisions now about their coverage, and they deserve stability and they deserve confidence in the choices before them. More than half of all of our seniors nationwide now choose Medicare Advantage for their health care. In my district, the number is even higher, where nearly 65% of beneficiaries are enrolled in a Medicare Advantage plan. And for these seniors, Medicare Advantage is not an alternative to traditional Medicare. It is Medicare. It's what they know and it's what they trust. And that is why I believe strongly that we must protect this program and ensure that it remains stable, affordable, and accessible for future generations to come in the Medicare process. I agree that the program is due for thoughtful reforms and modernization, just like any program is. But I do not support sweeping, broad stroke across the board changes, especially when we do not yet understand how they might impact seniors. And that's who always has to be at the top of our mind, is our seniors. Reform should always begin and end with the beneficiary senior in mind. I support common sense modernization that strengthens the program's long-term stability without jeopardizing affordability and access for seniors. And we can and we should make data-driven improvements that enhance integrity and accountability. But we must not undermine the foundations of a program that's working and working well for 34 million Americans. Like the Better Medicare Alliance, I believe that the key to strengthening Medicare Advantage lies in preventative, person-centered care. Seniors want a system that rewards better outcomes, not more paperwork and bureaucracy. They want care that keeps them out of the hospital, not buried in red tape. And that same philosophy drives much of my work in Congress. As a founding member of the Make America Healthy Again caucus, I have worked to advance the same principles that make Medicare Advantage successful, focusing on prevention, nutrition, and access to affordable, high-quality care. The caucus is dedicated to addressing the root causes of chronic disease, promoting a healthy lifestyle, ensuring that Americans can lead longer, stronger lives. These goals align closely with Medicare Advantage's emphasis on preventative services and coordination of care that help seniors stay healthy and stay independent. Medicare Advantage has proven that we can deliver on that promise. Studies show that seniors on Medicare Advantage plans receive more preventative services. They have lower rates of avoidable hospitalization, and they spend less out of pocket compared to those in fee-for-service Medicare. These are real results that we can hang our hat on, and that make a difference in regular people's lives around the country every single day. However, we also have to be honest about the challenges the program is facing. After several years of payment reductions during the Biden administration, combined with persistently high levels of healthcare utilization during COVID in the epidemic, plans are under real strain, and there's real tough decisions being made. These pressures are creating a ripple effect for beneficiaries, providers alike, and communities across the country. In upstate New York, we're also seeing the challenges how the wage index is being handled. The Centers for Medicare and Medicaid Services, CMS, it adjusted the rural wage index in a way that created a windfall for hospitals in my region. But those changes were not reflected in Medicare Advantage benchmarks. And that means plans operating in upstate New York must contend with higher reimbursement rates on the hospital side without any adjustments to payments. The result is pressure that can lead to higher premiums, and is probably going to lead to higher premiums this year and reduced benefits for our seniors. And that's a really unfortunate outcome. That's why I'm a proud co-sponsor of the Protecting Options for Seniors Act. It's a bipartisan bill that would fix the wage index issue and ensure that seniors across regions like upstate New York are not unfairly caught in the middle of bureaucratic mismatches. Beyond the specific fix for upstate New York, we also need stability in the way that CMS sets rates and administers Medicare Advantage programs overall. Earlier this year, I led a letter with members of the New York Republican delegation urging CMS to prioritize stability for beneficiaries as it finalized the 2026 Medicare Advantage rate notice. We asked CMS to ensure that the payment rates reflect real-world trends in healthcare costs and utilization. We urge the agency to use the most up-to-date actuarial data and make the rate-setting process transparent so that both plans and beneficiaries can understand how rates are determined and plan accordingly. We also emphasize that the goal must be to prevent further disruptions like those caused by previous cuts and regulatory changes that we experienced during the last administration, which those led to higher costs and reduced benefits for enrollees. Our message was simple. Medicare Advantage is working, Washington not so much, and Washington should not undermine what works. For more than 2 million New Yorkers who depend on Medicare Advantage, stability is personal. It determines whether or not they can keep their doctor, they can afford their prescriptions, and continue receiving the supplemental benefits that make their lives better. Those benefits are what makes Medicare Advantage so unique. Dental, vision, hearing, wellness, nutrition. Those are helping seniors live longer, healthier, and more independent lives. And that needs to be our goal, always. These are not luxuries. These are necessities that help seniors age with dignity, age in their homes, and age with confidence. Medicare Advantage is especially valuable in rural communities like the ones I represent in Western New York and the Southern Tier. These areas face very unique challenges, such as long travel distances. It's not uncommon to have 45, 50 minutes between certain hospitals. They have provider shortages. We don't have a lot of people setting up shop in our rural communities and saying, I want to open a family medicine practice. I mean, that's not a luxury that we have in our rural communities in New York, in a state that's declining in population. And we have limited access to specialty care. Through services like transportation assistance and telehealth, Medicare Advantage helps close those gaps so that people in rural communities aren't left behind. And at a time where we have just created the Rural Health Transformation Fund to improve care in our medically underserved areas like mine, the last thing we should do is take away those options and move back to a one-size-fits-all approach. We should be building on those successes, not chipping away at them through short-sighted changes. The Medicare Advantage model shows us what a modern, value-based health care system can look like. It rewards better outcomes. It improves coordination, and it empowers patients with real choices. That is the future of healthcare that we should all be working towards across the healthcare system. But that future depends on collaboration. It depends on policymakers and providers alike and advocates like all of you, working together, having conversations so that we can strengthen the program responsibly. It depends on Congress exercising thoughtful oversight and ensuring that federal agencies are acting in the best interest of the senior. That should always be top of mind. As a member of the House Energy and Commerce Committee, I take that responsibility very seriously. And I remain committed to ensuring that any changes to Medicare Advantage strengthen the program, not take from it. When I meet with constituents, they're not asking for more bureaucracy. They're not asking to jump through more hoops. They're asking for stability, predictability, affordability, and the freedom to choose a plan that meets all of their needs. Medicare Advantage usually is the answer to that question for a senior. I also want to acknowledge the work that many of you do in this room to innovate this program. Whether you're operating health plans or running community health centers or advocating for our seniors, you're helping build a system that focuses on prevention, coordination, and compassion. We know that more than 90% of Medicare Advantage beneficiaries report being satisfied with their plan. Now, I can't say that many members of Congress have 90% of their constituents thinking that they're doing a good job. But Medicare Advantage passes with flying colors. That number speaks volumes about the trust that this program has earned from its beneficiaries. But it's also a reminder of the responsibility that we share to keep and preserve that trust. Medicare Advantage is not a perfect program, and there's always room to improve. But for the vast majority of seniors that it serves, it works, and it works well, and it delivers better outcomes and greater choice and real peace of mind. Those are the values that we should be fighting on Capitol Hill to protect. As policymakers, we must ensure that any reforms we pursue build on the program's success and continue to put our seniors first. And that means grounding decisions in real data. It means listening to those who serve seniors every day and being transparent on how policy changes affect real people. As we look to the future, I want to make one thing clear. I will continue to be a strong, rational, beneficiary-centered voice for improvements that keep our seniors healthy, protect their choices, and improve positive outcomes. I will continue fighting to ensure that Medicare Advantage remains strong, it remains sustainable, and it remains stable. And I will continue to advocate for policies that give our seniors the peace of mind that they deserve after a lifetime of work and contribution to our society. I'm very grateful for the opportunity to be with you today with the Better Medicare Alliance and for all of you within the leadership of this organization. Together, we can make sure that Medicare Advantage continues to be one of the great success stories in American healthcare. There's exciting things on the horizon. Every single day, we're seeing more and more breakthroughs. What AI will do to healthcare, in this generation and generations from now, our mind can't wrap itself around. But we need to protect our seniors today and always be mindful to keep these important institutions together. So thank you for your partnership, your advocacy, and your unwavering commitment to our seniors. And it's an honor to work alongside with you to strengthen Medicare Advantage and ensure it remains a cornerstone for generations to come of great care in this country. So thank you very much for having me.